All right, we have to have some really brutal conversations about these Medicaid cuts by the numbers. But before I share, I'm in algorithm viewer hell again. So if you can please engage with this video, some of the ones I made the last 48 hours, I would appreciate it. I hate asking, but I'm sorry. Bernie Sanders released how many people by state are going to lose their Medicaid coverage, and I just listed the top 10 in ascending order. Number 10, Arizona, 365,984 people will be kicked off of Medicaid. Number 9, Michigan, 453,100. Number 8, Pennsylvania, 483,868. Number 7, Illinois, 535,849. Number 6, North Carolina, 651,382. Number 5, Georgia, 651,540. Number 4, New York, 1,019,121. Number 3, Texas, 1,671,965. Number 2, Florida, 1,936,421. Number 1, California, 2,368,466,000. Every state is going to have a shit ton of people losing their health care coverage. But I just picked the top 10. Notice a lot of them are red states, but a lot of them are swing states. So the people that are going to be kicked off of it are the elderly and disabled because of the work requirements. People are going to lose their coverage because they've added a lot of paperwork requirements to get Medicaid and to stay on it. Bureaucratic, difficult to navigate processes that are going to cause people to lose their coverage because they didn't meet deadlines for reporting all this bullshit, right? Children are going to lose coverage. Lawful immigrants who are here on work visas and so forth, they get assigned a tax ID number and they pay taxes. They pay into Medicaid. They pay into it, but they're not going to be able to access it. That's part of the numbers too. Now, the bulk of the people that are going to lose Medicaid coverage are, not entirely, but a large number are people who need to go to work. There's work requirements now, right? This is where the hard conversation comes in. I'm in a rural area right now, and there are a lot of people who are unemployed. I was in a Dollar General in a line. 2 phone calls they got while I was in line asking if they were hiring. And the assistant manager said, no, we're not hiring. Then my husband and I were golfing at a local golf course, and somebody called in and said, are you hiring for maintenance? And they said, no, we're not hiring anybody right now. We know college students up here because it's a college town. They've applied to Myers. They've applied to all the restaurants around here. They keep applying, and nobody's hiring. So you're going to lose your Medicaid if you're in that situation. You're probably already in poverty. These are jobs that pay poverty wages. So you better have reliable transportation, which a lot of people in poverty do not. So as soon as you lose your job, you're kicked off of Medicaid, and it's going to just take forever to try to apply for another job and apply for Medicaid again. This is what we're talking about. Now, I'm going to get brutally honest here. Please, I know it seems like I'm being judgmental. I don't know how else to share this. There's a percentage of Americans, thanks to our education system, thanks to our economic system, you know the type. They maybe have poor dental care. They're missing teeth. They didn't have dental coverage. They didn't take care of their teeth. In addition, when they start talking, the way they talk, it's very clear that they did not receive a good education, if you know what I mean. They generally don't look like they take care of themselves. I want you to think about all the people who were spotlighted at the MAGA rallies. Those kind of people. I'm sorry. They're MAGA supporters. Not all of them. They need to find work. They're on Medicaid and they're unemployed and they need to find work now. What's going to happen when they walk into places and present themselves for an interview and so forth? What I'm saying is, it's not going to be easy for a lot of people who are on Medicaid right now to find work, but they're all going to be kicked off of it. So there you go.